The threat of antibiotic-resistant infections is dramatically larger than previously thought. The CDC says drug-resistant infections kill more than 35,000 people a year, and that's the equivalent of about one person every 15 minutes. New antibiotics are needed, but the experts say not enough are being developed. That's a problem. Our investigative correspondent Anna Werner discovered the unsettling reason why. So, Anna, what'd you find out? This is very scary stuff.
As in so many things, experts say in this case it comes down to money. New antibiotics are expensive to develop, and because their use is limited, there's not a lot of profit potential for pharmaceutical companies. But they're badly needed, say doctors, who are seeing more and more patients with infections they can't cure.
He was just a teenager.
Roxana Sudderth says her son Trey, a healthy high school freshman, loved sports.
He would just want to be with his friends and get better at football and get better at basketball.
But she says after playing basketball with his friends near their Jacksonville, Florida home in May, Trey developed a sore on his foot.
And it just looked like a small blister.
He also had pain in his legs. Doctors gave him antibiotics, but the next day...
He said, "Mom, I can't. This help. There hurts too much. I can't walk."
She took him to the hospital, where they told her 15-year-old Trey had a life-threatening infection, MRSA, a bacterium resistant to antibiotics.
He had blood clots all over his legs and in his lungs.
Over 19 days, his condition deteriorated until finally doctors told his mother it was time to take Trey off life support.
There was nothing that they could do because the antibiotics weren't taking the MRSA away. MRSA was still there, and
they said the antibiotics weren't working.
They said that nothing was working.
Trey's isn't the only case.
We have seen infections that are resistant to all the antibiotics that we have available.
Dr. Helen Boucher is chief of infectious diseases at Tufts Medical Center in Boston. She says newer drugs are critical. How soon do you need new antibiotics?
Well, we need them yesterday. And
yesterday. Not now, but yesterday.
Well, truly, we need more options for our patients yesterday or now.
A big part of the problem? Many major pharmaceutical companies have gotten out of antibiotic development. Now it's mostly small companies like Pennsylvania's Paratech. Evan Lowe is CEO.
There's only about 13 or 14 of us today that are actually working on antibiotics as small biotech companies.
Paratech says its new antibiotic, Nuzyra, treats pneumonia and skin infections with fewer toxic side effects. But it's been a tough sell at many hospitals, where budgets are tight and federal Medicare reimbursements for antibiotics are low.
Payers and hospitals have said, we have our generics, we need to control our costs. We'll just go ahead with the older antibiotics that we have here today. They're telling us that they don't want our innovation.
In response to questions, the American Hospital Association told us its members are dedicated to the judicious and appropriate use of antibiotics. But Dr. Boucher says,
yes, we've been forced to go back and take some old drugs off the shelf that we would never use because of the toxicities associated with them.
So you, in some cases, are using older drugs because you don't have a newer, better option?
Absolutely.
You're using older, more dangerous drugs?
Yes.
Paratech's president, Adam Woodrow, says fixing the system will take action from Congress.
We'll have to see some form of legislation to enable drug companies to survive in this environment.
So in other words, you're looking at a situation where without help, the industry could go under?
Without help, the industry could collapse.
Something critical to families.
I just wish I could see him one more time. Let him know how much I love him. I just want to see him. Mm-hmm.
There is a bipartisan proposal in Congress called the Disarm Act that would change the way Medicare reimburses for antibiotics to allow for higher payments to hospitals. We spoke with one of the co-sponsors, Senator Casey, who says the goal is to stabilize the market so more medications are available or would be available. But it's a complicated problem.
I mean, you really feel for Trey's mom there.
Very much.
And, there are 35,000 other Americans who die every year in similar circumstances. So why aren't companies working to create more medications implications for them?
Well, it's complicated because the companies, a lot of drugs, you can make money on them time after time after time. Diabetes, cancer, heart disease, right? People take these prescriptions month after month, year after year. Antibiotics are great because you come in, you cure somebody. It's a single-use only. And then there's this payment system where under Medicare you bundle expenses for a particular diagnosis in a hospital. Yeah. That's how they often get paid. And they say, well, if you raise the cost of the antibiotic, then it doesn't fit under the bundle.
Oh, yeah.
So, basically that's why these drug companies, these startups are saying, and these small companies are saying, we need help.
Yeah.
It's astonishing there's only 13 to 14 of them now.
It really is
That just blows my mind.
Really
That was especially tough because it started out, it's seemingly such a simple thing.
Yeah.
A little cut in his
That you
foot.
could fix, that could be fixed.
Right. MRSA's tough.
I think it's what you call a market failure.
That's what people are saying. The market is broken, exactly.
Anna, thank you very much.